Before moving on to the afternoon session, we would like to congratulate to everyone as Indians because Chandrayaan-3 has landed the south polar region of the moon. This victory scripts a new chapter in India's space odyssey. So introducing ourselves, I, Dr. Meghna,
and I, Dr. Anvesha,
welcome you to the heart of the whole event, comprising of academics, administrative, topic discussion, and panel discussion.
Cost escalation in healthcare has been a predicament as old as time. For instance, in our hospital, the Mission Hospital, in the ED, a resuscitative procedure such like cardiac resuscitation can incur a very heavy financial burden on patient relatives without any guarantee of any positive outcome, a conundrum which becomes very difficult to explain to said relatives. Therein comes in the notion of the frugality in healthcare specialities. Thereby, we invite our speakers on stage to share their scholarly insights on the pros and cons of cost cutting on clinical outcomes in emergency department setup.
So calling on stage all our speakers and moderators, Professor Dr. Suresh David sir from CMC Vellore,
Professor Dr. Sanjeev Bhoi sir from AIIMS Delhi,
Professor Dr. Shudipa Das from MKCG Medical College,
Dr. Deepak Kumar sir, Consultant Nephrologist, Mission Hospital. And as our moderator, we have Dr. Taraknath Tarafdar, Senior Consultant, Department of Emergency Medicine, Mission Hospital.
Good afternoon. After a lot of discussion comes the cost. And the question, who bears the cost? What we usually know in the government sector, the taxpayers bear the cost. And in the private sector, it is out-of-pocket expenditure of the patient. Dr. Bhoi's last presentation was a ray of hope to us that government may take up funding the emergency expenditure. As far as I know, no insurance company gives a cashless benefit till now for any emergency treatment, and neither for any ambulance transfer or treatment in the ambulance. So this was meant to be a debate, but we had discussed we should focus on various sides. So first, I call upon Dr. Sanjeev Bhoi sir to share more lights on this, and this will be mostly on the public health sector, government part, how the costs are being done and how, what is the effect if we are cutting the cost on the care provided.
Thank you for that question. There are two aspects I'll briefly touch upon. One is from the patient perspective, and second is from the institutional perspective, and third is at the level of national perspective. In the individual perspective, the various state governments has now has protected for financing for the care delivery of a patient coming to the emergency for first 48 hours, especially Rajasthan government, Tamil Nadu government, Delhi government, and also Maharashtra. So these are the governments which they have already made 48-hour cashless, means the government is going to pay the expenditure of the patient if they develop a road traffic crash, especially it is for that. But now Delhi government, for all emergencies, anything, they, for any days, it has gone any length, any days they can stay in the hospital, be in the government sector or private sector. Whatever the expenditure, including of operative, including of devices, drugs, everything is covered in the Delhi government, The Delhi government is paying for that. So this is based on individualistic approach. Second is even Ayushman Bharat is now providing, protecting care in emergency care, but specific. Now we are trying to expand it to all emergencies rather than only for trauma. So this is from the government side, sir, this thing. And nationally, for all emergency care,